Share my screen for the beginning here. Welcome everybody to the Her Plan Power Lunch for the month of September. You are part of our wonderful Her Plan community of care, collaborating together for comprehensive care to help them both, moms and babies. So as you come in, please introduce yourself in the chat. We would love to hear about your organization or ministry, especially your state and website, so we can see that and any unique thing that you feel like you do. Or you can talk about what you want to get out of this wonderful Hunger Action Month Power Lunch. So feel free to use the chat to get to know one another as we're getting situated here.
So Cheney, you can just see the PowerPoint. You don't see the slides on the side. Is that correct?
I can see some slides, but I'm gonna show our map first, and then we'll go back to your map.
Sorry about that.
Yeah. No, that's good. I was flipping around. Welcome everybody. We're just getting situated here. Ooh, birth doula from East Tennessee. It's really remarkable, all the evidence coming out about how much doulas can do to improve birth outcomes and maternal mortality. So welcome. Thanks for being here. One of the great unique things about Her Plan is just how many states and how many categories of care we have. Currently, we are in 21 states with 25 subcategories of care. So we are just so thrilled to welcome you all. It's our diversity that makes us strong, and we are really, really happy to have all of you here with us today. If you're not familiar with how to use our directory tool, we know some of you are new to the Her Plan Network, or maybe you've registered and you appear on our map, but you haven't actually started using our map for referral purposes. We've designed this map with you guys in mind. Our primary audience are the providers. Of course, you can introduce it to the women. Of course, pastors and churches are going to want to use it. Anyone can access it online, but it's really built with you in mind, with social workers, case managers, care coordinators that are at all of your different organizations and wanting to use this map to refer to other pre-vetted life-affirming organizations. So we want to do all that hard work resource vetting for you so that you can focus on what you do best, which is caring for women and families. I'm Cheney Mullins-Gooley. I'm the Her Plan Provider Support Manager. It's really exciting to be able to focus this month on hunger and food insecurity. This is a topic we haven't even come close to touching in any previous power lunches. We've been doing this a few years now, and I am just so happy to have found literally a subject matter expert at Catholic Charities USA to cover this topic. So I really think it's going to impact all of you. Even if you don't do food distribution, you are going to need to refer to it. You're going to need to be aware of the women that you're serving and how this might be one of their needs. And again, how Her Plan encourages us all to think about collaborating for comprehensive care in order to help them both. So if you're wanting more information about how to use this map, please contact me at info@herplan.org. I'd be happy to arrange a live training or some sending you of our training videos so that you can be more familiar with using this map for direct referral. And we're also in the middle of updating our software to make it more move quicker and more user-friendly. So if you have suggestions for us, please let us know. And also, if you don't see yourself on the map, it may be because you simply haven't finished your details and compliance process. So once you fill out that registration form, that's the first step. And then you start getting our newsletters and invitations to our power lunches, but there may be something remaining that we need in order to actually get you listed. So we do have a small food checklist, a small housing checklist, or we look up your license, or we need to know the qualifications of those who teach your classes. So if you're not sure where you are in that process or you're confused about it, please don't hesitate. We want to accompany you. We know it's complicated and can be difficult to fill out forms. So we do it because we really want a high quality directory so you can refer with the utmost confidence. And if you're confused at all, not being able to find yourself on the map or feel that you're listed inaccurately, please contact me at info@herplan.org. I'd love to help you. And with that, please do keep going, keep introducing yourselves. We love seeing each other's work, but I am going to turn my screen share over to Jane to share her beautiful, crisp PowerPoint. I am so excited for you guys to learn everything from government programs and assistance to models of really impactful community services. So I just cannot wait for this. Thank you, Jane, so much.
Well, thank you very much for having me. I'm Jane Stenson. My title is Vice President for Food and Nutrition and Poverty Reduction Strategies at Catholic Charities USA. And we're based in Alexandria, Virginia. I've been with Catholic Charities for many years now, so have had worked on many different issues from aging services to housing, but probably the last 10 years, a real concentration in our food work, as well as poverty reduction kind of captures a lot of public benefit programs, financial education, how do we support people to save, even people with very limited income. If you can put $5 away, you have some type of emergency fund. So we really do a lot of work in that area. A lot of agencies have curriculums and provide support on that. So let me get into the guts of the presentation. Okay, so can you see that okay?
Yes, and if anyone wants to adjust your view, there's a view button in the top of Zoom, so you can go to the standard or immersive or gallery or speaker view. And so then I think if you start the PowerPoint from the beginning, Jane, you should be good to go. It's showing the preview mode, not the presentation mode.
Yeah.
There we go.
Okay. All righty. So Catholic Charities USA is a
Oh, I
network.
still can't see the
Oh.
full. Somehow you pressed it and it didn't make it
Okay,
bigger.
well, let me just close this and I will get back. I'll redo it. Sorry.
Sorry about this, guys. We had it all set before
I
and
know, sorry.
technology's never on our,
Best
on
laid
our
plans,
side.
yes.
I think maybe if we just hit view from beginning again one more time, it might work for us this time.
Okay, so, okay. Can you see that?
No, I think you have to share your screen again, but maybe we can after you reset it.
Okay, I thought I had, all right.
Oh my goodness, guys, it's so exciting in the chat to see all your different.
Okay.
There we go. That's perfect, Jane.
All right, great. So as I mentioned, we're the national office. All of our agencies are independent. We don't have any control. They're all, as you probably know as well as I, they're a local diocesan entity under the auspices of the bishop of the diocese. There are 167 member agencies. That's slightly less than all the dioceses in the country. But most agencies have some type of formal human service that is typically Catholic Charities. Sometimes they're rarely, but sometimes there isn't a Catholic Charities, but there might be other human service providers there that are in some way, shape, or form affiliated with the diocese or run by a religious order. We cover all 50 states and all 5 territories, and we actually have reasonably robust services in Guam. I think we're the largest private provider in Guam. We're in the Northern Marianas, we're in American Samoa, so much like the Catholic Church, we pop up everywhere. So it's quite extensive network. It doesn't mean agencies are similar. We vary in size from the smallest, maybe a 1 or 3 person office. That's very rare, but American Samoa would be an example of that, to very large organizations like Catholic Charities of Western Washington, which is based in Seattle, the New York agencies, Chicago, with maybe 1,000+ employees. Now, not all of those are full time, but so varies dramatically. We don't dictate what services they provide. That's largely a decision of the director and the board, obviously, but it really comes out of what does the community need? If food is well covered through other nonprofits, Catholic Charities may not have a large presence in food in some cities, and we would refer to other organizations. Most agencies, though, across the board do immigration, refugee resettlement. Food is our largest service, so most agencies do provide food, behavioral health, counseling, early child care, senior services, and all kinds of permutations in between. I know at the very beginning, if you were on at the very opening minutes of this, someone was talking about the doula program, and we do have one in San Antonio, and I believe Spokane, and there are probably others I'm not aware of. So quite varied. This network served about 14 million individuals in 2022. These aren't guesstimates. We do an annual survey every year. We know a fair amount about our agencies. We track where their funding comes from, how many they served, what services they provide, and how many people served within each service. As I mentioned before, agencies are part of the local diocese. So I am going to try to flip to this. So let me just show you. So I recognize, can you see that, or do I need to screen share?
We can see it.
Okay, perfect, wonderful. So we have a national website, as do most organizations. It's Catholic Charities USA. This isn't the main page. This is the Find Help page. But we have an agency locator. And so if for any reason you are looking to make a referral, you might want to explore what Catholic Charities has to offer or look at other providers. We have, you can go down here. There is there's a map, but the map is almost, if you live on the East Coast, it's almost impossible to read. But you can click on the button, put in your zip code, whatever is easier. You want to look at a state profile. You can, well, Delaware's easy. There's one Catholic Charities in Delaware. So there's, that will link you to their website. And then their website will provide an overview of what is being offered. I know you have programming in West Virginia, so I wanted to just show this. We don't design agency websites, that's up to them. So we don't have a lot of control as to what's on here. Some are obviously better than most. I think West Virginia does a pretty nice job, though. But just to give you a sense, there's always a programs and services button. So these are their main services: children, outreach. They have they cover the whole state. The Diocese of Wheeling Charleston is the state of West Virginia. So that's a lot of territory, not a lot of massive highway systems. I mean, obviously very significant highways cut through the state, but there are a lot of smaller towns, mountainous areas. I've gone on a few site visits with our agency in West Virginia, and you can lose cell service an hour before you get to the site and then an hour after. So some of them are quite remote. They have, I believe, 6 regional offices across the state. Sorry about
Julieta or Juliet Machado.
I'm so sorry. Hold on. So regional approach, so services are brought a little closer to people, but this is typical of, I think, most agencies' website, just providing what it is that they do, where to find it, who to call, Just look at one more just to give you a little, um, let's see, Pennsylvania has many Catholic charities. So, just going on here, Philadelphia is by far the largest. Um, again, oops, that's ours. We have to go to the Philadelphia website. So at any rate, I just wanted you to know that resource exists. Um, there is something on every agency in the country. Again, this is all locally developed. So they go from beautiful websites to, oh, I wish there was more, but that gives you a sense. So let me go back to the PowerPoint. Are there any questions on that or?
Yes, please, if you guys have questions throughout, you can use either chat or Q&A. So I'll be looking at both and feel free to put them in anytime and I will be able to give them to Jane either in the middle or at the end here.
Yeah, and I will try to go on. So food is by far our biggest service. There are over, sorry, 37, these aren't our statistics, this is national statistics. 37 million people that suffer from, I would say, food insecurity. Um, Food insecurity is really a term largely used in the US. Obviously, we don't see extreme hunger as you see in other parts of the world. Food insecurity really gives a sense as a parent, as a mother, as an individual. Do I have an idea that I'm going to be able to eat tonight? Do I have an idea where I'm going to get the resources to purchase food? Is that something that keeps me up at night? Am I worried about where I'm going to get the resources to feed my kids? That's food insecurity. So that can take a toll on anxiety levels, the quality of food you purchase. If you feel your income's insufficient, you're going to end up buying cheaper food so you can stretch that dollar. So these are things we really pay attention to. You want people to have a stable income, something that they know is coming in regularly, that they can depend upon, they can budget, and they can better understand how to plan and secure the nutritional needs of their families. Of this 37 million, 11 million are children. So very significant. Um, as I mentioned before, food is our largest service. As a network, Catholic Charities USA, this is all 167 agencies, served 14 million individuals. I believed we served 11 million in food. Now, there's a lot of double dipping there. A lot of people come for food and then drop their child off at Head Start, or come for food and then go see an immigration attorney, come for food, go see their therapist. So food is just a critical baseline service. Even agencies that say, no, we don't have a food pantry, we refer to, I don't know, the parish down the street or whoever. Almost everybody has a closet, a drawer, gift cards in their top drawer. You have to be able to respond to that individual who walks in on Friday afternoon and says, oh, by the way, I have no food at home and I have two little children. So almost everybody does food, even though it might not be an organized service. I like to talk about it, and I've heard our agencies kind of echo this over the years. It's really significant. I will say most of our volunteers, as a network, we have about 250 to 300,000 volunteers across the country, far surpasses the number of staff. Network wide, I think we're just under 70,000 staff across all of these agencies. So we could not do the work of Catholic Charities without volunteers. A large portion of those volunteers are in food. It's really critical that we train volunteers really well because we always talk about food is the entry point often. Someone who is hesitant to come to a social service organization Maybe they've had a bad experience in the past. They have a real fear of organized services. Still will overcome that barrier to come in and get a bag of food. It's also a program that is not so intrusive, although most food pantries will ask for someone's name, address. Do you live in the county? And there are reasons for that. I'll talk about that in a minute. But just to track, there's not enough food that we can support them if they come every other day or every week. Usually it's once a month. And that's just to ensure that the food touches the largest percentage of people in need. Um, but it is a way to begin to build that trust. So it's really critical who you have as the frontline person at a food pantry. They begin to develop those relationships. They become aware that, oh, Mrs. Jones was here. God, she's been coming more regularly. What's going on? Is there a change of income? Did maybe she's taking care of her grandchildren right now? Whatever the circumstances are. You don't want to be intrusive, but it is an opportunity to kind of have those conversations like, oh, I noticed you're back. It's not quite a month yet. What's going on? Obviously, if there's a real crisis, we will serve them. But it really is an opportunity to kind of facilitate comfort, trust, also expose them to the other services that Catholic Charities has to offer. A lot of people come in and say, I'm looking for um, no salt food. My mother lives in the home. She has diabetes, hypertension. So that's an opportunity to talk about senior services. Oh, did you know we have a Meals on Wheels program? Did you know we have a senior center? And kind of begin to build that. So a lot of agencies will say, people come to us through our food pantries and our other food work. Um, as I mentioned before, most individuals, maybe not initially, but often are still coming for food once they make a connection with other services of Catholic Charities. These are our statistics. So I think I said 11 million. It's 12 million people that are fed by Catholic Charities. And that's done in a variety of ways that we'll talk about in a minute. It's about 44 million meals. Obviously, the typical box of food, if someone comes to a food pantry, we always ask how many people are in the household, and you get a box designed for how many people. We're not going to give an individual a box of food for a family of 5. It's usually a 3-day supply. So it's not enough to get you through the month, but it will plug holes, get you to the next paycheck, maybe allow you to save a little money so you can meet that month's rent. Food can really help with a lot of different things. We really consider it almost a housing service as well. If you can offset your food costs, you always want to pay that rent, pay your mortgage, don't lose your home, because that triggers a whole spiral, which is devastating for families and particularly children. Food pantries are our largest. Oops, that is how most agencies do their food work. This is obviously not the most exciting photo, typical food pantry. A lot of agencies pre-COVID, and then that was paused for a while. Now they're going back to it, but really have changed their pantry design into a client choice model. Um, I have a lot of videos of those, which I'd be happy to send, but client choice model really just mimics a grocery store. It does exactly that. It gives an individual choice instead of coming to a food pantry and getting a box of food that's pre-selected. Maybe you don't like yams. Maybe you, I don't know, only like white potatoes, or you're not a fan of green beans. So no use giving that person a can of that food if that's just going to be left on the steps of Catholic Charities. Or sometimes agencies will say, yeah, if we go to the bus stop, we know what's not popular because a couple of cans are left at the bus stop as people are heading home. But a client choice pantry allows individuals to come in still limited. You can take 4 of these, 2 of these, usually proteins, maybe 1 or 2, but really make a selection that they know their family needs and wants and will eat, so it won't go to waste. And as I mentioned, obviously that wasn't an option during COVID with all this work on client choice and these beautiful, welcoming spaces. Everybody had to shut that down and go into bag distribution, but most agencies are back to that. Um, just a mention, Catholic Charities, the larger network, we do have 6 food banks. And if you don't know, sometimes those words are used interchangeably, a food bank, a food pantry. So a food bank is a much larger organization. Um, Feeding America is their national nonprofit. Not all of them belong to Feeding America, but they are kind of the big engine that supports food banks across the country. Food banks deliver to organizations like Catholic Charities. Um, we may get a large order from the food bank, and then we would distribute to smaller parish-based or neighborhood-based pantries, as well as keep some for our own food distribution. So I like to explain it. They're more the wholesale and we're the retail. So typically, food banks don't touch the customer, they touch the provider. So we get the food from the food bank, we distribute to the individual. It doesn't mean we don't pay for that food. Most food bank food we still have to purchase, but you're purchasing at a significantly reduced rate and can really stretch your dollar. And many items are free if they have them in great quantity. Um, so we do have 6 that are just under the umbrella of Catholic Charities for historic reasons, whoever knows, but at any rate. But that being said, if Catholic Charities, if you go to our website and look for Catholic Charities of Tucson, do they do food distribution? And you don't see that there. They do, but just, for conversation, if you don't see that we're doing it or our location is way too far away, you can always go to the Feeding America website, put in your zip code, and it will link you to the Feeding America in your community, which in turn, it's a little roundabout, which in turn will give you where they distribute. And their distribution is quite wide. So that's a tremendous resource as well. Congregate dining. A lot of agencies do congregate dining, and that can be anything from this picture I happened to grab from Catholic Charities Reno's website. They do a daily meal for largely homeless men, but it's really open to anybody. So by the end of the month, they will report they start to see a lot of women with small children. Again, maybe they're on SNAP, maybe they're the paycheck is just depleted. So it's a way to come get a hot lunch. It's cooked fresh daily. Catholic Charities in Baltimore has a beautiful daily feeding program, 365 days a year, come rain or shine. In the highest snow impacted days, they're still doing food. They have a residential program in the building, and those residents are recruited on a day that volunteers can't get to the center. And so that hot meal is still put out. They serve about 500 people a day. And these things vary. Sometimes they're supported through government funding. Sometimes this is all volunteer work and all donations. So, but again, knowing where these places are, you might need an emergency referral. And sometimes people, someone is evicted or they're fleeing domestic violence. They're not in a shelter, but they're kind of couch serving. They might not have all the equipment to cook, but where can you get a hot meal? So knowing where your congregate dining facilities are is it can be a tremendous resource for families. After school meals, we run a lot of after school programs. Usually there's some kind of sports activity, homework help, just a place to keep kids safe, particularly if the parent's working and they're going to go home to an empty house. So these programs, I don't need to explain, you know what these are, but the federal government, we'll talk about this in a minute. If kids are within a certain zip code that usually is defined by is at least 50% of the population qualifying for kids at school for free and reduced lunch. That's kind of a real measure. And if so, you can tap into this federal program and provide any child in your after school program with a free snack. And if you think they're going home to a food insecure household, you can give them dinner as well. Typically, it's not a hot meal, it'd be a sandwich, much like what this child's eating, something that's portable. But again, knowing where those after school programs are, a lot of school systems run them, a lot of churches run them. They might not be connected to the federal food program, but even if they aren't, most serve some kind of healthy snack, just to, again, reduce food insecurity. Meals on Wheels. I know this might not be a program that you all are tapping into a lot, but it can serve more than older adults, particularly if somebody's really medically fragile and can't get to, a meal site or has terrible transportation issues. I will say we have a number of agencies that do Meals on Wheels. Catholic Charities West Virginia just reminded me when I was on their website earlier, they have a in-home meal distribution program. It's not Meals on Wheels. They fundraise for it themselves. Meals on Wheels is grossly underfunded, and most of those programs always have a wait list, but they just augment what Meals on Wheels can't provide. So again, it can be, sometimes you can get 5 frozen meals for the week because there are not enough volunteers to deliver daily. Gone are the days that an individual comes to the home every day with a hot meal. Usually it's 5 frozen meals, just to save time and ensure that agencies can deliver to all of the households on their list. So just one more. And then I think culturally, we're seeing a lot more of this in the US, so this isn't unique to our network, but we're seeing a lot more of agencies really look at their footprint and looking at how they can grow food. This is a community garden. Obviously, it's a container garden out of Catholic Charities Orange County. I was there last December. They had a This was on a parking lot behind their building. So everybody uses what they have. There's a beautiful picture in Louisville. Louisville has 6 community gardens, but there's large land plots that were underutilized in the city of Louisville that now they are leasing to Catholic Charities. So their community gardens really look like a very lush community garden. I thought this was very creative and a beautiful example of an agency that only had a parking lot, how they turned that into a vibrant community garden. These are on raised beds so that seniors can do the weeding without having to bend over too far. Kids can still access their food pantry is in the building, kind of attached, so people can come pick up their food. If there is fresh produce to be had, they can come for that. This becomes kind of a social activity for a lot of the seniors. They're beautiful murals. There's a small shrine to a Vietnamese saint, and I cannot remember, but this is largely in a Vietnamese community. It's just, I thought, just a beautiful use of space. So I'm just going to stop there for a second. I'll get into a little bit more of our work as I talk about some of the other federal programs. But are there any questions?
Okay, and I was wondering when you were talking about that shift to what you called the client choice model, is that now considered best practice? And, how does that really work when you're making that transition? And then how do you make sure that the food in that choice is culturally sensitive to the population?
That's a great question. Yeah, I would say client choice is really considered best practice because what I want to eat for dinner and what you want to eat for dinner is probably there's some variance, What I want to eat for dinner and maybe an African immigrant might look a little more dramatic. I grew up I'm from southwestern Pennsylvania, Irish Catholic family, meat and potatoes and not a lot of spice. Somebody who's a new immigrant from the Congo might be looking for peppers and rice and beans, and I don't even know. Or, again, people with health allergies. We have a beautiful pantry in upstate New York. I think it's out of the Diocese of Albany that just really focuses on people with extreme allergies and health issues. That's a very expensive pantry to run, but they've made a commitment to that. I think we're going to see more of that, and I'll come back to that. But so client choice, it's really just a design. It's you're still sourcing the food from the same places. I think agencies are doing a better job by telling the community what kind of foods they're looking for instead of getting 5 boxes of Nutella. I mean, who doesn't like that on their toast in the morning? I get it. Is it the healthiest option? No, So you want to have things. I think food pantries as a whole provide much better quality food. It's there's much more sensitivity and attentiveness to is this healthy? A lot of our agencies have formal policies that they will not accept candy, they will not accept soda. Sometimes it creeps in when you work with a food bank. If you want their good stuff, you have to take a little bit of their bad stuff. I say bad in terms of calorie and sugar content. I mean, it's fine to have a treat every now and then. I mean, it's not to um totally, but because they have to move it too. So it sometimes you'll go into a pantry like, oh, this shelf doesn't look so great. Oh, Jane, I had to take it, because I really want that produce that they're delivering weekly. So there are trade-offs. But they can limit, they can say, please only one bag at Halloween. Well, probably the month of November, the Halloween candy that doesn't sell, you'll see a lot of it on the shelves of our pantry. We try to minimize that. Um, I think USDA, which flows through Feeding America and then down to us, there's a lot more fruits and vegetables than there was 10 years ago. There's a lot more protein. Um, USDA is committed, and we actually had some struggles with this to provide halal and kosher food to make sure there really are options for people. Um, we had kind of I don't know if it was an emergency, but a call from central Missouri. The Afghanis were being resettled there 2 years ago in that just chaotic departure from Afghanistan. And they were going to rural Missouri largely because the rent was affordable. um, they had very large families. How do you afford an apartment of any significant size in downtown St. Louis or Kansas City? So not rural Missouri, but around small towns, there still were jobs and, they always look at can people find employment? But there was no halal food. Catholic Charities couldn't find it. There were no halal butchers. And so we called USDA and they hooked us up with some providers. So I think there are efforts. There's so much room for improvement, but trying to really educate the donor, um, it's things like peanut butter, rice, really staples, uh, canned fruit with no added sugar, salt-free vegetables, anything like that are really high demand items. Um, Try not to take too much bakery. So anyway, way too much on that. But Yeah, so client choice is really just design. It just gives, usually you have to take smaller numbers. You can't just open the doors and let everybody in. You might take 10 people at a time. There's signs up everywhere like family of five. Okay, you get so many proteins, so many canned goods. But it's a much, who doesn't want to pick out what they want? It's a much more respectful, I think, environment instead of coming to a food pantry. Here you go, But during COVID, that nobody groused, we all understood that was what needed to happen. Um, so I will weave in a little bit more about Catholic Charities, but I think on the food side, there are a lot of resources. Um, the federal government puts billions of dollars into food, and we still see a lot of food insecurity in the US. Some of that is, you know, maybe some of these programs aren't adequately funded, but a lot of it is people don't understand them. They don't realize they qualify. So they're not taking advantage. So I have a lot of slides on this, and I'm going to try to be brief. I'm not trying to, you know, make sure you know all the ins and outs of all the federal nutrition programs, but just so you know, they're on the slides and they're tremendous resources. So if you have questions, if you think somebody might qualify for whatever program, you have a resource to go back to. So these are the major federal nutrition programs across the US. I will say the territories are a little bit different. I don't think you all are in the territories yet, so we don't have to worry about that. But just because the 50 states have SNAP and it's an entitlement does not mean Puerto Rico has it in the same way, shape, or form. So just background. But SNAP is by far the biggest. It is the biggest federal nutrition program without question, significantly bigger even than school lunch, which is quite large. So we'll talk a little bit more about that. I'm sure you're well aware of the WIC program, something that would touch your work very dramatically. And if you're not aware of it, I would really encourage you to learn more about the WIC program. It is such a pro-life, pro-woman and child program. It supports women from prenatal up until that child is 5 years old. Um, this is the after school meal. It's the child and adult. We'll talk about that in a little bit. School lunch has now expanded to school breakfast and lunch. So again, particularly if you have new immigrants or even new being that they've been here 5, 7 years, but maybe this is the first time their child's going into the public school system. They may not understand what this is, and their child is entitled to these programs, and it will alleviate some pressure on the family if their child can get a healthy breakfast and lunch while they're at school. Mom doesn't have to pack a healthy breakfast or lunch, so saving a little bit of money. After school and summer meals, we'll talk about that, and then just some of these others. So again, I will try to be reasonably brief, don't want to overwhelm you. But again, SNAP, oh my, I didn't realize I'm kind of getting a little tight on time. This just really relieves pressures, not only on the family, it gives them a benefit card where they can go into the grocery store, purchase whatever they want in an environment that no food pantry can replicate what a well-stocked grocery store can. Get the kind of vegetables, get the kind of meat. They don't want pork, they only eat chicken, they're vegetarian, get exactly what they want. So we'll go quickly. SNAP is such a large program, even though food, as I mentioned, we served 11 million last year. For all the charitable food bags, congregate dining, SNAP still serves, only 1 in 9 is served by the nonprofit sector, and the rest of food insecurity dollars is going into SNAP. So it's a very, very significant program. It's our first line of defense against hunger. It helps tens of millions of low-income individuals. Almost 42 million Americans receive SNAP. Now, one thing about SNAP is not everybody gets the same benefit. Uh, it's tailored to your income. So as your income goes up, your SNAP benefit goes down. So the people in the highest need get the biggest benefit. As you begin to maybe move out of poverty or get that job, maybe you're part-time, maybe you're seasonal, you can come in and out of the program. But it is designed to kind of move people off. There is a workforce requirement for SNAP, but that doesn't impact families with children. I think it's under 6. It's really for able-bodied adults, no children between the ages of 18 and I believe it's 50, but don't quote me on that. It's somewhere around there. They're supposed to be working at least 20 hours or in school for 20 hours. This was waived during COVID. It is back. So a lot of pressure to kind of move single people that were on SNAP now that's unless they have a disability, a significant disability that keeps them from working. Obviously, SNAP is there if that's a need, but really moving people out into the workforce. It's administered by USDA, so this is just a good thing to remember. All of the money for these nutrition programs comes from USDA, but most of them are administered through your state. So SNAP, I manage a national SNAP grant, and it can be very challenging because the way the state of Maryland handles SNAP and the way the state of Texas handles SNAP can be very different. They can have different asset tests. So I don't know all the asset tests, but I may be able to keep a car of the value of $2,000. In other states, that car value is $1,800. So those are differences that could knock a family off SNAP. You're only allowed so much money in your bank accounts to qualify for SNAP. So they're different things. So if you're looking for the rules about SNAP, always go to your state site. Just do SNAP state of Texas, SNAP state of Iowa, whatever, and it will connect you. Sometimes it's through Department of Education. Sometimes it's through Department of Health. Sometimes it's through the Department of Human Services. That's all state administered. So if you just Google SNAP in your state, it'll take you to the right site and it will tell you the specific qualifying criteria for your state. This is just a link that will take you, I believe this takes you, I won't go there because of all the back and forth with screen share, but will help you find the appropriate office within your state to learn more about SNAP. The nice thing about SNAP is it's an entitlement. So during COVID, we saw a large increase in the number of people that were qualifying for SNAP. Well, that money isn't capped, so it can respond to times of crisis. That extra money went away in March of this year. The program is now constricting a little bit to respond to a time of greater prosperity. So SNAP has the ability to kind of respond in times of need and then come back down in times of more affluence. Just a slight mention on this, there is a element of SNAP, it's called, typically referred to as DSNAP. Our agency in Hawaii is now doing DSNAP applications across the state. DSNAP is when there's a devastating disaster. And people like myself or other individuals who typically make more money to qualify for SNAP can still get it, largely because your kitchen was destroyed. You don't have the ability to cook food. So DSNAP is really flexible. It's very short term, but it might give you a month, 2 months of a SNAP benefit where you can go into a grocery store and you can buy that roasted chicken because you don't have the ability to cook. You can buy prepared food. Most SNAP benefits in regular times, you can't do that. You're buying grocery store off the shelf, the refrigerated produce section. You can't go in. Sometimes you can go into a restaurant with DSNAP, um, limited value, but because you don't have the ability to cook at home because the tornado or the hurricane just totally destroyed your capacity. So just to know, SNAP has a little flexibility that other programs do not. This is child and adult care food. Again, I won't go into all of this, but just know if you have families that have school age kids, helping the parent link to an after school program not only provides a safe haven for those children while their parents are finishing up the day at work, but usually gives them, and if it's the federal program, those snacks and that dinner have to meet particular nutritional requirements. So there's usually milk, there's usually a fruit, it's whole grain bread. Sometimes it's a challenge to get the kids to eat it, but again, you're taking a little bit more pressure off the family. The child's not going to be starving when he gets home. He's had a snack or she's had a snack and maybe even has a sandwich or something to eat when they get home for dinner. This program also works in adult day centers. So that's why it's called the child and adult care, but I won't go into that. What is it? Oh, this is the WIC program. Just spend a minute on this. WIC is amazing. As I mentioned, it works obviously prenatal all the way up to 5 years old. They're trying to push that up a little bit because some kids aren't ready for kindergarten yet at 5, depending on the cutoff, and moving it up to 6 would ensure that every child is in the school system so they don't lose a year. There were some increases to WIC during COVID, giving recipients more access to fruits and vegetables. That's all being looked at. But just look at the last bullet here. 43% of those eligible for WIC don't participate. So there's still a lot of work to be done to let people know about the WIC program. I was going to show you some slides from our agency in Buffalo just to give a sense. We have about 20 agencies that run WIC under Catholic Charities. In most states, WIC runs under the public health system. But you can go to, again, WIC Connecticut, WIC whatever state, and it will take you to the main administrative body within your state so you can find out where are the WIC centers. You can get lactation support. You can get nutrition education. For a young mother, first child, it's so overwhelming. And you can meet with a nutritionist. They'll help you do menu planning. How do you get your kids to eat these vegetables? Give you little tricks of the trade. So it's more than just an EBT card with purchasing power on it. There are lots of other supportive services that go with WIC. Again, you'll have these slides. This will just take you to the website of Catholic Charities Buffalo. And I just use that as an example of some of the ancillary services that are attached to the WIC program. So you think of it, it's way more than just an additional EBT card. Most people, though, that are on the WIC program also qualify for SNAP. So if you are seeing women that are on WIC, you might want to ask them, are they accessing SNAP? If not, why not? They might want to explore that. This is National School Lunch. Again, I think this is probably the one federal nutrition program we're very aware of, but encouraging families to take advantage of that. And now most school systems offer a breakfast option. Summer food, just a minute on this. Summer food is a federal program that nonprofits, largely school systems, get funded to offer school lunch. And usually it can be a snack, it can be a mid-morning snack, it could be an afternoon snack. You have to have some kind of program. So it's almost like a quasi summer camp, depending on who's running the program. But again, it's trying to keep those kids plugged into a healthy snack and lunch when the school systems no longer offer school lunch because school's out for the summer. We learned a lot during COVID. There's always been a lot of frustration with the summer food program because you can't just give out a bag of food. It had to be face to face. It had to be kids coming to a center, participating in some activity, and also getting a bag of food. Well, sometimes it's really challenging for parents to deliver their kids in the summer because they're working to this congregate site. Um, and during COVID, obviously, they were just pushing school lunch out because there was no congregate anything. So now there is this kind of step. A lot of people have been arguing, saying in the summertime, give parents a little bit more money on their SNAP card so they can make up for their meals their kids aren't accessing with the school lunch program. That is not a universal adaptation yet, but in some rural communities, they are waiving the requirement to have a congregate summer feeding site and just giving families in rural Iowa, rural Kansas, or maybe it's $30 a month per child to just augment with a recognition. No more school lunch. There's increased food costs for that family, particularly if you have multiple kids. School is probably, I mean, summer is when most of our food pantries see the highest need. We float a long way after Thanksgiving and Christmas because people think about those kinds of donations, but it's actually summer what's the greatest need. People are distracted, their kids are home, their vacations, but a lot of other families are coming to the pantry to make up for that loss of the nutrition program courtesy of the school. This is just USDA has a big commodities program. It purchases commodities from farmers and growers across the US and funnels that through Feeding America and the food bank system to get to organizations like Catholic Charities. So these tend to be bulk items like macaroni. Sometimes it's dairy. Those of you of a certain age remember the cheese giveaway. It can be milk. It can be USDA will purchase whatever, could be nuts, all kinds of things, but it's usually reasonably healthy. People have to self-declare income. I won't go into all that, but this is where a lot of food pantries get their produce, get their protein, get their bulk items like soup, beans, peanut butter, just the basic stuff. This is more, these are food boxes for seniors. I won't go into that, but just to know there are a lot of resources out there to try to deal with this whole food insecurity issue in the US. Meals on Wheels, just to mention, this is a program that always just kind of breaks my heart because it's not a entitlement. And I think if you are an isolated senior or an isolated adult and really cannot get yourself out of the home to access a hot meal, to be put on a wait list just seems just, I don't know, just inhuman. There should not be a wait list for Meals on Wheels, but this program is capped. So once agencies reach their limit, there's no more money to be had. But it is an amazing program that you probably know as well as I, delivers meals to people that are so isolated and at least gives them one healthy, very nutritionally balanced. Some people complain it isn't spicy enough, there's no salt, but it is quality food that at least gives you one nutritionally balanced meal. Oh, just a little bit more. So we'll go into that. So just one other resource, a lot of what I said is on the slides, but if you are interested in learning more details about any of these national programs, the USDA Food and Nutrition Service has an excellent website. Each of these programs has probably a page or more. You can really read the details. It'll always link you to your state office that provides this. And this is my information. If I could ever help you connect with our network, if you have any questions about these other programs, I'd be happy to help. So, talked way too much. I'll stop there.
This is wonderful. Thank you so much for the full overview of the different programs. I think a lot of us don't realize that that might be available to clients. And then if we don't know to tell clients about it, they won't be able to access them. So we have a question here about blessing boxes and little food pantries that popped up during the pandemic. Is there any categorization of them? Is there a online directory? Do states keep track of where they are? Is this a trend that you think is going to last past the pandemic?
You're talking about the small kind of food cup.
Yep.
I, we have a hard time keeping track of all of our food pantries within Catholic Charities because they change. And, a lot of them are in parishes. We might manage them, but the parish owns that facility. So, and that, the parish is refurbishing their congregate area. So we're kicked out for 6 months, but then invited back. So I would doubt it. There is an app, it's a meal finder that can connect you to various food distribution sites. I think anyone who's running those, I will try to get the link to that and I can get that to you, Cheney. But you can be anywhere in the US and you put in your zip code and it will tell you about the food pantries in your area. But that information is only as good as to who's putting the information in. So I think there's lots of room for those. I don't see any reason why it's not determinant of size to get that into that database, and then people could find out about that. But USDA doesn't track that. They're tracking food banks and maybe the sites that are participating in their federal food programs. Beyond that, that wouldn't be a federal resource. But there are, I think, with all the development of apps, some really creative ways to get your programs out there and get that information to people who really need it. So I will try to find that.
And tell them to register for her plan if they're part of a life affirming church or community, or maybe they'd be good for additional resources. But let us know if you know of any in your community for sure. We've got our wonderful team of analysts trying our best to keep up with growing resources. So it's a big job, as Jane was saying. Well, thank you all so much for joining our September Power Lunch. I'll be sending out a wrap-up email with these slides and the recording and some of the resources that Jane mentioned. If you have any further follow-up questions, feel free to contact me anytime or reply to the wrap-up email. Blessings to you all and have a great day.
Thank you. Thanks so much.